Hi, Paul. Nice to see you again.
Hello, Narina. Great to see you again.
How are you and what are you busy with right now?
Since we last met, I've moved to Monash University and I'm lecturer in anthropology here, teaching in the anthropology program as well as the behavioural science program and continuing my research on tuberculosis.
Tell me more about your current project on TB.
So I've just got back from Daru Island in the western province of Papua New Guinea. And I've been setting up a very small project with the Burnett Institute over there to interview people being treated for tuberculosis on the island and people from neighbouring islands and from the mainland who go to Daru Island to seek treatment for tuberculosis.
Why Daru Island and why this program?
Daru Island is in many ways quite remote. There's one airplane that goes there a day. The landing strip is right down the middle of the island and pretty much divides the island in half. There's quite an interesting history to the people of Daru Island. The indigenous people of Daru Island are called the Kiwi people, and there's a very strong relationship between the Papua New Guineans of these islands in Western Province, as well as the Australian Aboriginals in the Torres Strait Islands. And there's a lot of exchange and migration between these islands. Daru Island has a population of between 17 to 20,000 people, depending on those migration movements at any one time. And sadly, it's a region that sees a lot of tuberculosis and unfortunately is also seeing a lot of multi-drug resistant tuberculosis cases. So we're seeing a rise in strains of tuberculosis that are resistant to the drugs, the first line drugs that are administered for people who have been diagnosed with this disease. Those patients have to then be treated by a more complex cocktail of drugs and for a longer period of time. So the rise of drug-resistant tuberculosis in this area is really a concern, particularly because of the high flows of migration from all the different islands.
Do you die from TB on Daru Island?
Yes, a large number of people die from tuberculosis, which is ridiculous because it's a curable disease. I mean, it's a disease that shouldn't be with us, and yet it persists. There are a lot of incurable diseases that we are spending lots of money trying to understand. But even if we developed cures for those diseases, how could we expect that we're able to roll them out effectively if we can't even roll out the treatments for tuberculosis effectively? A disease that we've known how to treat since the late 1940s.
Why do we have this kind of situation in this area?
People on the island are very poor. Tuberculosis thrives in conditions of poverty, in conditions of overcrowding, in conditions of malnutrition, and disease of most forms transmits very quickly. 4 or 5 years ago, there were 400, 500 deaths from cholera, for example. It's sadly a place where infectious disease thrives because it's quite densely populated. It's a small island with a large number of people who live in quite dense clusters of communities. And a disease like tuberculosis loves that because it's a slow-moving disease. It takes a long time for the disease to become active, to become infectious, but then it's infectious for a long period. And so there's a chance of infecting anywhere up to 10 people while someone's infectious. And because of the slow-moving character of the disease, it thrives on these gaps in socioeconomic conditions. So where people don't have treatment facilities that are able to provide them an early diagnosis, the disease spreads very readily and people become sick very readily. In fact, some 80% of people on the island have been infected. Globally, the World Health Organization estimates that only 1/3 of people have been infected, but on this island, 4 out of 5 people have been infected, they estimate. And the number of drug-resistant tuberculosis cases that are currently being treated on the island is also quite disproportionate to anything you see in other places around the world. Quite a large number of people have had to be treated for tuberculosis on the island, but this has done very little to reduce the rates at which people are contracting the disease. And so really the situation is at stasis. And to address this situation, we really need to figure out how can we best deliver treatment, how can we best facilitate patients to have treatment outcomes that are important to them, and how can we treat the maximum number of people in the most effective way possible.
Yesterday we prepared a montage of news coming from Daru Island on TB. Have a watch.
Papua New Guinea has one of the highest tuberculosis prevalence rates in the world.
We report about 29,000 cases of TB per year. We are classified as one of the third or fourth highest burden TB countries in the world.
TB is a big problem across the nation. It's burning now. It's like fire.
Tuberculosis is preventable and curable. World Vision is working in hotspots like Port Moresby and Daru. Effective treatment requires daily medication. However, many patients don't complete the treatment, leading to new, multiple drug-resistant strains of tuberculosis.
The extrapulmonary TB cases is triple than the new pulmonary TB cases of 174. Total cases are 652, detected from October 2015 to January 2016.
The island is overcrowded and industrial rubbish is a common eyesore on the beachfront. People from the Fly River who travel to Daru using canoes sleep, cook and eat on the outriggers with no proper sanitation provided for them. The province is declared one of the tuberculosis hotspots in the country. Many of the TB patients on the island are on regular treatment.
In order to effectively and efficiently address this epidemic, funding and additional resources are immediately required.
The fear of tuberculosis on Daru Island has now entered schools, with teachers feeling unsafe to interact with students in the classroom. Over 800 students and 29 teachers of Daru Secondary School are now trying to prevent the spread of TB in the classrooms and dormitories.
How do the people on the island experience this situation, and how can we change it?
So this is exactly what we're setting up with our project. We are trying to find out how people experience tuberculosis treatment, how people experience tuberculosis disease, how they handle the obstacles they have to face by being away from family, by not having a means of communication, with their family back home, by trying to perhaps get some form of income or some kind of, or provide for their family in some form while they're on treatment. The whole reason we've set up this project to interview people being treated for tuberculosis is to understand more about the disease from their perspective. Tuberculosis research up until now has been dominated by laboratory research into the mycobacterium tuberculosis, into the drugs that we can use to treat the disease, into the targets in the body that we can identify to treat the disease, or the biomarkers that we can use for diagnostics. But what will we know of tuberculosis if only tuberculosis we know? If we want to treat tuberculosis, if we want to reduce transmission, if we want to increase the number of people on treatment and on care, then we have to know about the people who are experiencing the difficulties that come with being infected with tuberculosis and becoming sick with tuberculosis. And I should be careful to note here that being infected with tuberculosis doesn't mean that you're necessarily going to become sick with the disease. When I say that 80% of the people on Daru Island have been infected with the disease, I don't mean that 80% of the people are sick and infectious. I just mean that 80% of people on the island have been exposed to the disease and have become themselves carriers of the disease in their own body. Now, in the conditions that they live in, they have to make choices in their life about do I go, if they're from a different area of Western Province, they have to make a decision. Do I go to Daru Island and get treatment? Do I try and continue to work or fish or harvest, or do I try and continue to look after my family, or do I go to Daru Island and look after myself and perhaps face the possibility of not coming back home for 6 months to 2 years? If we don't understand those experiences, and if we can't help and provide an enabling environment for people living in those conditions, then we have no hope of rolling out an effective treatment for the greatest number of people possible.
And a TB treatment can be very long, right?
Absolutely, absolutely. I spoke to one woman who was away from her family for several months and had no means of communication with her family. Having a cell phone, having a mobile phone is quite rare. Having money to spend on phone calls and data is even rarer. And so she had no means of communication with her family back home for several months. And when she finally went back home, her family had thought that she was dead. Her 7-year-old daughter, who waded through the waves to the boat that was coming ashore because she saw that it was her mum there, her daughter thought she would never see her mum again. Listening to those stories is chilling, but also incredibly important if you're going to spread the word that tuberculosis is treatable and let people know that there's a supportive environment to get treated in. Perhaps communication or providing communications is just as a really important complement to treatment as providing good nutrition and providing good housing and making sure that people are looked after in many different ways as well.
Who is helping and how?
There are a few NGOs working on the island. Burnett Institute is one of them. World Vision is another one of them. And the Ministry of Health for the Papua New Guinean government has a very small arm there as well. And through these collaborations and these NGOs on the ground are really helping each other to address this situation, and they make sure that their programs complement each other and that they're addressing parts of the problem that will all fit together nicely. If you speak to people on the island, they certainly would like their own government to be doing more for them. One thing that they're about to commence on the island is community-wide screening. So they're about to screen, they've got a screening van with an X-ray in it, and they're going to go to all the different communities and invite people to participate to get a chest X-ray. And then people identified with tuberculosis will then be invited for more diagnostics and then put onto treatment if they're found to be active with tuberculosis. In some of the other islands in the Asia Pacific, treating people with active disease as well as latent disease, so disease that is not yet active, has proven to be really effective in reducing the rates of tuberculosis in the long term. So community-wide screening is quite effective. There was a study in Vietnam that I was involved with just recently, and they found that community-wide screening in the southernmost province of Vietnam increased the number of people who were put onto treatment by a factor of 2.5. So they found that places where they had the community-wide screening versus places where they didn't have the community-wide screening, they were able to put 2.5 times more people onto treatment that had tuberculosis than in the villages where they didn't have the screening. So screening, actively going out into communities and looking for people who have tuberculosis and helping them get cured is a really important measure to help address the tuberculosis situation.
If you had the opportunity to change one thing, what would you bring to Daru Island tomorrow?
Jobs. In the long term, relying on NGOs to provide food or to provide treatment is not a sustainable solution. What needs to happen in a place like Daru is having a more sustainable economy that raises people out of a low-income, poor socioeconomic conditions, improves their public sanitation, improves their nutrition, improves their housing. In fact, just these improvements in socioeconomic conditions have proven to be quite effective at addressing problems like tuberculosis in high-income countries. So prior to the advent of antimicrobials in the 1940s, many high-income countries already had reducing rates of tuberculosis, incidence of tuberculosis that was declining because socioeconomic conditions were giving people better health and their immune system was more robust. They were able to control the disease. Their immune system was strong enough to sort of control tuberculosis. It's estimated that only somewhere between 7 to 12% of people infected with tuberculosis actually become sick with tuberculosis. But I suspect in a place like Daru, where so many people don't have enough food to eat, don't have great housing, don't have a great place to sleep, and don't have public sanitation, in these places, I'm sure that the number of people who become sick with the infectious disease is higher. So if I could bring one thing to Daru Island, it would be some form of infrastructure so that they could have trade that was a good source of stable income, so that they could have more autonomy over the drugs and the treatments and the doctors and the clinicians they need to their island, so that they can send their own children off for a really good education who might come back as doctors. If I could bring one thing to the island, it would be a form of sustainable employment and trade.
How was your personal experience there?
People are really friendly. People look out for each other. They look after each other. I was speaking to this one gentleman who his mother died of tuberculosis, and he met another tuberculosis patient who had no family on the island. And so he invited this gentleman into his house and said, look, while you're on treatment, stay with us. I mean, that kind of generosity, when you have so little, is just incredible. And so sadly, I think when people talk about Daru Island, there's unfortunate stories that dominate and stereotype the place. But in actual fact, it's a place of incredible possibility, of a place where people really do want to address this situation, where they really do want to help each other complete this treatment, where they recognize the symptoms of this disease and they want to do something about it. Daru Island is an interesting case example of social inequalities and the disparity between high-income and low-income communities. When such large numbers of people are infected and sick and being treated for tuberculosis on an island like Daru, you just leave thinking, how is this even possible in today's day and age? I mean, it's a completely different world. In Australia, most people wouldn't even know what tuberculosis is. Most people of my generation don't even know what tuberculosis is. And on an island like Daru, if someone's sick, often the first thing they think about is tuberculosis because it's so common for them. And this is a country that's just a hop, skip and a jump away from Australia. It's literally just across the border. And yet people die from this disease there unless they're able to get better nutrition, unless they're able to get better treatments, unless they're able to get better public sanitation, unless trade builds up in this area so people have a stable form of employment and are able to provide themselves with better housing and better living conditions, then people will continue to die in places like Daru from this disease. It's not going to be solved by pills alone. It's going to be solved by improving socioeconomic conditions and treating both active and latent cases. So working with them is actually incredibly rewarding.
Thank you, Paul, for this conversation, and I hope that your work will impact the situation on Daru Island and will create a positive change in the lives of the people suffering from TB.
Well, thank you, Narina, and have a wonderful day.
Thank you so much. And thank you for watching. Keep wondering and see you next time again. Bye and ciao.